Hi, I'm Lucas.
And I'm Brian.
And this is the Quacks Podcast. One of my biggest focuses for this podcast is to bring you treatments and drugs that may be dangerous, but which the medical establishment downplays the danger. Now, they do this in a variety of ways, usually by crafting studies that don't appropriately take into consideration long-term effects. Sometimes they manipulate statistics in such a way that the dangers are downplayed. Sometimes they just don't test against the proper placebos. There's a lot of tricks that can make a treatment seem safer than it is. And the motivation to do this is usually millions, sometimes billions of dollars. Now, I want to make you aware of these treatments so you can stop and question whether they're really right for you. Now, sometimes they're worth the risk, no doubt about it, but we want to properly analyze the risks and rewards. I actually remember one time I was talking to my personal doctor, and she was talking about how bad pharma reps can be. Now, she's been in practice for many years. She told me a vast majority of the drugs that reps would come in to teach her about just disappear after a few years. You don't really hear about that. But there are probably thousands of drugs and treatments that at one time were the best of the best, but they're just gone now without a whisper. So if you want to make good decisions, we need to know about both the successes and the failures of our institutions. If we don't learn about the failures and all we see are the successes, we put more trust than we should in the institution, and that's dangerous. Now, one of those potentially dangerous treatments out there at this moment is called gadolinium. Now, gadolinium is used to make contrast dyes, which are used in MRI scans to make the images clearer and easier to read. Now, gadolinium, it's a heavy metal, which is toxic to humans. It's put into a chemical cage, which supposedly makes it safe. But there are people speaking out saying that they have been irreparably harmed after having it. Actually, Chuck Norris's wife is one of those people, and she is pushing hard for these dyes to be treated as the dangerous agents that they are. And these people, they're not making it up. They often have very high levels of gadolinium in their urine, and they try all kinds of chelation therapy in an attempt to get the stuff out of them. Now, basically, how it works is you go in for an MRI. They inject you with a contrast dye, and afterwards, the doctor can read the scan much easier. You're supposed to pee out the contrast dye over the next few days to a week and go on your merry way. But maybe that isn't the case. Also, when these dyes were introduced decades ago, MRI technology did not make the clear images that it does today, so it might not even be necessary. In fact, at one point in this interview, I pressed Dr. Catriona on what kinds of scans actually need these dyes, and, well, you may be surprised at her answer. So I have two guests, Dr. Catriona Walsh. She is a graduate of Cambridge and worked as a consultant pediatrician for the NHS. She has a book on contrast dyes and runs the website called The Food Phoenix. My other guest is Mollie Brewer, who is a patient that was harmed by these dyes and runs the website mridye.com, which is a great source of information and education on gadolinium toxicity. So enjoy the interview. So I have a couple really special guests with me today. I have Catriona Walsh, who is an author and runs the website foodphoenixco.uk, and Mollie Brewer, who is a patient advocate and runs the website mridye.com. Now, until just about a month ago, I had no idea that this even existed. I thought MRIs were some of the safest scans you can get. So we're going to hear today about how they might not be so safe. So I think Catriona, she's going to kind of give us the technical details. Mollie's going to give us a little bit about her experience and what she went through getting these MRIs. So ladies, thank you so much for coming to the podcast.
Thanks for having us.
Yeah, thanks for the invite.
You're welcome. Yeah, we're doing a three-person podcast today, so there may be some stepping over each other now and then. But let's dive right in. Catriona, I'm glad you guys are here. What is how do I say this? Gadolinium? What is gadolinium-based contrast agents?
Yeah, sure. So basically, gadolinium is an element. It's actually a toxic heavy metal, and in order for it has kind of paramagnetic properties, which means that it behaves a certain way in a large magnet. And that makes it very interesting for people who arrange MRI scans, because it means that it will show up different things in the body because of those properties.
So these are used for MRI scans. They inject these into you when you're going to get one, and it helps the image show up.
To an extent, yeah. It alters the image a bit. So the gadolinium element on its own is highly toxic, and if you inject it straight into somebody, it'll just kind of cause horrible toxicity symptoms immediately, and will probably kill them fairly quickly. Wow. So, yeah, it's a really nasty thing. So they have incorporated the gadolinium into these contrast agents, if you think of the contrast as a sort of a cage that they build around the gadolinium ion to try to make it a bit safer, then you can get away to an extent with injecting people with the contrast and not cause quite the same amount of toxic effects.
Wow. I mean, that's so confusing to me that they would take something that's an element that is highly toxic and then use that as a contrast dye. I mean, how did they come up with this?
Yeah, well, I suppose the contrast agents have been around for maybe the last 30, 35 years or so. So they basically were designed, I guess, coinciding with the MRI technology. So in the very early stages, MRIs weren't anywhere near as clear as they've become now, because just the technology has changed and the different sorts of things that you can do with computers and stuff, and also the strength of the magnets has been able to increase. So these days you can get much clearer MRI images without using any contrast at all. But in the early days, the MRIs were quite blurred, so they wanted to find something that would show up certain things a lot more clearly. So they wanted to show up things like tumors, I suppose, and they wanted to show up blood vessels, which can be very important for sort of funny things where you might have malformations of blood vessels causing symptoms. And the contrast also, it picks up more lesions that you'll find in things like multiple sclerosis and a few other things. So in the early days, the contrast probably was a lot more useful than it's become recently, but that's largely because of the way that technology has evolved. So that it's actually the contrast now doesn't really make a huge difference to diagnosis in most cases. But that was basically why they brought it in. It was in order to better visualize things like tumors and blood vessels and certain other lesions.
So do you know how this heavy metal compares to like lead or cadmium in terms of toxicity?
Yeah, so great question. So essentially gadolinium is similar to lead in that it is a very potent calcium channel blocker. So lead also exerts a lot of its effects by mimicking calcium in the body. And gadolinium does the same sort of thing. So gadolinium to our enzymes looks extremely like the essential nutrient calcium, but it doesn't behave in the same way. So it will bind into enzymes and channels and things that use calcium, but block them instead of working properly. And in that way, it's very similar to lead. And I suppose in the same way that lead then has a preference for things like bones and teeth that would be very high in calcium, so does gadolinium. So gadolinium will get into bones, and the bone will act as a reservoir later on in life, particularly as you get older and you start getting osteoporosis and your bones start to deteriorate a little bit. That can be a constant source of recurring gadolinium in your bloodstream, a bit like lead. As people get older, gets released back into the bloodstream.
Wow. So you can get this stuff in your body and your body will put it into your bones, and then literally you can be poisoned in an ongoing manner. Is that kind of what you're saying?
Yeah, but there hasn't been any kind of research looking at the long-term effects for anyone, let alone what happens after a few decades, which is probably the length of time that would take, for osteoporosis to release reasonable amounts back into the system. But yes, it's a real concern because bones do act as a kind of a reservoir. It's not the only place where you find gadolinium showing up. I mean, it gets into your brain tissue as well, and into your skin and into your joints and into your liver and kidneys, into your eyeballs. I mean, it gets anywhere where the blood goes. and then anywhere where calcium ends up going, which is basically all the cells in your body. But it seems to have preferences for certain, even certain regions of the brain will take up more gadolinium than other regions of the brain.
So I know there's different types of these contrast agents. Can you go over those and kind of what makes them different?
Yeah, I mean, I suppose essentially there's kind of broadly two different categories. So the oldest ones are something called the linear agents. And if you remember back to what we mentioned about the cage that the gadolinium is put in these contrasts, with the linear agents, the cage is a bit more open-sided, so that would make it possible for a bit of for some of the gadolinium molecules to get popped out of that little cage. So it's less stable, and that means that the gadolinium can come out of the cage and start interacting directly with processes in the body. So it's what they call kind of a free gadolinium. It doesn't actually stay free for any length of time because it immediately starts binding to enzymes and getting into like your bones and your joints and stuff. Now the linear agents were some of the first agents, so they've been on the market much longer, and they're much better researched. Not that they're well researched, but they are better researched than macrocyclics, which are much more recent. The macrocyclic agents, so if you think of that cage again, the gadolinium is more enclosed inside the cage, and that makes it less likely for the gadolinium to come out of the cage and start acting directly on your body. But again, that doesn't mean that the gadolinium inside this macrocyclic contrast is much safer. In fact, if you look at the neurological side effects of some of the macrocyclics like Prohance, you find that Prohance is one of the most neurotoxic of all the gadolinium contrast agents. So there is this, theoretically, the linears would be more damaging to people, but, with greater levels of toxicity due to this effect where the gadolinium can come out. But in practice, we don't really know enough about them, and certainly because I see clients who are suffering from side effects after having a gadolinium contrast. A lot of them have had some of the macrocyclic agents like Prohance or like Dotarum or like Gadavest. Those would be some of the big macrocyclic ones, and they have their side effects are just as nasty as people who have had some of the macrocyclics like I had. I had Multihance, and other people have had Magnavist or Optimark. Now, Omniscan seemed to be a particularly nasty one, and that was a linear one, and that was associated with a lot of the side effects in renal patients that we hear about. Because renal patients, the way that most of the gadolinium contrast agents are eliminated from the body is in the urine. So they told us that don't worry about it, because if you just drink lots of fluids, you'll pee out all of the contrast in about 4 days, which was never true. But obviously then if you have a problem with your kidneys and you're not actually eliminating properly, then, renal patients were known then to retain much more gadolinium and run into problems. So really they're the main group of patients that have been studied in any kind of detail, is some of these renal patients who develop some extraordinarily nasty side effects from gadolinium contrasts. And most of them had received the linears initially, and then, some of them then, had a mixture of linears and a mixture of the macrocyclic agents, but not very many of them had macrocyclic agents on their own. But a large part of that was because the macrocyclics were introduced much later, much more recently than the linears. So there were just much more people who were getting the linear agents.
So these kidney patients, they can't excrete the gadolinium like it's supposed to be excreted. So what kind of things, you said that they have some really bad things happen to them. What kind of side effects do they have?
Yeah, sure. So the condition that has been researched the most is something called nephrogenic systemic fibrosis. So it's this kind of connective tissue disorder. So it affects all of their bodies, but in particular, they have this very, very striking tightening and hardness of their skin and their joints in particular. So they can, and it tends to be very, very painful. So they complain of a lot of burning pain. Their skin breaks down. They can have a lot of very broken skin, a lot of redness, a lot of what we call plaques and hardened areas. They often end up in wheelchairs because their joints get so tight. But it affects, it affects all of their tissues as well. So it gets into, into their abdomens, into their lungs, which can make breathing very difficult, into their hearts. And the main cause of death with nephrogenic system, or one of the main cause of death with nephrogenic systemic fibrosis is actually cardiac problems. It can cause heart failure. It can cause heart arrhythmias. It can cause heart attacks, all sorts of things. It just gets into all of their body organs and causes some pretty devastating and horribly painful side effects that have been very well documented. And the mortality rates are extremely high.
Wow. I mean, so I'm guessing these side effects don't go away. They just get worse and worse until they die?
Generally, I think there have been a few cases where they have improved. But it's hard to know why, because, there's been a little bit of research trying to give them various chelating agents, and they haven't made a lot of difference. And I think there's been a little bit of research, on using things like dialysis to see if that would improve things, but it hadn't been very successful. So there's the odd patient with nephrogenic systemic fibrosis who has recovered, but by and large, for most people, it's been a progressive thing and very unpleasant.
So I know we're going to get on to kind of these side effects affecting people who don't have kidney problems. But before we do that, one other question I just wanted to ask, because I think you touched on it a little bit earlier. Until I learned about this, I thought MRIs were probably some of the safest scans you could get. CT scans, obviously you get a few hundred hard x-rays worth of radiation. But MRIs, with magnetic resonance, it seemed very safe. So you were saying earlier that they're maybe not used for all the scans. So what MRIs can you get where they won't use these, and which ones are they really going to push them on?
Well, I suppose the indication, the studies recently haven't really shown that much of a benefit to using the contrast for nearly everything. They'll often use it for cancer patients, but if you look at the research on adults and children, there's no benefit compared with using the non-contrast MRI plus or minus PET scans, which use a CT. At the moment they use CTs, I think they're working on PET scans that will use MRI scanners, but I don't think commercially that's really available at the moment. So as far as things like cancer goes, there doesn't seem to be a benefit to getting the contrast, but the contrast is generally offered.
Okay.
A lot of facilities will use it to do something called MR angiograms. So again, the contrast isn't actually necessary for these either. There are certain computerized technologies and certain CTs or certain MRI scanners that will give you the same results, similar sort of images where you can get the diagnosis in the same way, but you have to have this special technology in order to get that. So not all MRI scanners have this technology available. But companies like Canon and Toshiba have both got technologies that will give you a non-contrast MRA, which is the magnetic resonance angiography.
So it sounds like what you're kind of saying is that no MRIs really need this contrast dye.
We don't know because the research hasn't really been looked at in much detail. But basically, I think there was maybe one type of liver cancer in children that maybe the contrast MRI did show up a bit more detail. But for pretty much anything else that I looked at, it didn't seem to be that helpful because there were other ways of reaching the diagnosis. So another thing that it's often used for is for multiple sclerosis, because the contrast will show up more lesions than the non-contrast. But having said that, the contrast in the studies where they were, where they were trying to work out the diagnosis, the contrast didn't alter the diagnosis in any cases at all. And there wasn't any proven benefit to seeing more lesions. So the non-contrast MRI showed up lesions. It just didn't show up quite as many lesions as the contrast MRI. So it didn't actually alter the diagnosis. It didn't alter the management. It didn't alter the prognosis. In fact, probably the more, there is some research suggesting that the more contrast agents, MRIs that you have with multiple sclerosis, some of your neuropsychiatric indicators go down a little bit, like your verbal fluency can go down if you've had more contrast MRIs. Again, this is an associative thing, so you can't necessarily decide that it's cause and effect. But it is a real concern, especially when the contrast MRIs don't help with anything. They don't keep you out of a wheelchair. They don't stop you from dying. They don't really alter your management. So why risk it?
Yeah, it sounds like you can basically refuse these dyes, whenever they're offered. If you're getting an MRI, you can always refuse these. There's really no case where they're going to pressure you and say, we really need this dye for a scan to show up.
Yeah, well, it's interesting that you say that, and I've kind of written about this a little bit in my book. So there's a whole consent procedure that you should really be going through with your doctor, where you look at what your options are, you look at the risks, you look at the benefits. If there are other investigations available, but they're not available in your facility, your doctor is supposed to mention that to you as well. And your doctor is not supposed to coerce you into getting a scan done. In practice, what I find is that quite a lot of people have sort of said that their doctor has fired them for refusing the contrast. Like they've sort of gone, well, I'm okay with getting the non-contrast MRI, and then their doctors have fired them, and they haven't been open to having, like a frank discussion about the risks and benefits, or they've been very dismissive of the risks, or sort of said, your kidneys are fine, you're going to be fine. Like this is all being blown out of proportion. So, I mean, there are a lot of ethical things as far as your doctor refusing to treat you because you stand up for yourself and make an informed decision. It's not good practice, but it does seem to happen with some people. And that was something that I did want to write about in the book, because I wanted to, make sure that people realized that they have the right to make their own decisions when it comes to their own body. So long as somebody doesn't deem them incompetent, which means that they don't understand what's going on and they're not in a fit mental state to make their own decisions, then they can make their own decisions, and they cannot be, they shouldn't be coerced into making any other decisions.
Yeah, I know that's a real issue that's kind of coming up in our time, is the whole concept of medical consent. It came out of The Hague, it came out of World War II. It's just our whole medical system is built on this concept of, even if somebody is doing something that is going to kill them, even if they're saying, I don't want this and I'm going to die, you're supposed to be able to say, okay, that's your choice, and that's more important than saving someone's life against their will. So, I mean, that's such a huge issue. So let's go on to, because obviously these side effects that you were mentioning before with the kidney patients, these are coming up in people who do not have kidney problems. So let's talk about what people experience and what you guys are seeing out there from these dyes. So what are some of the side effects, the symptoms that people are having?
Yeah, so pain is a huge feature. Everything from headaches to burning in skin, in muscles, to deep bone pain, a lot of sort of chest pain as well, whether it's rib pain or actual lung pain, and gut pain as well. And then fatigue is another huge one. So people are sort of like, oh, just where is my energy gone? So sort of chronic fatigue. And then a lot of neurological problems, things like brain fog, memory loss, both short-term and long-term memory, confusion, and mood symptoms are actually very, very, very common, especially anxiety. Like, even having these thoughts that just jump around a lot. So finding it very difficult to concentrate, while also being, almost panicky or outright panicky, and thoughts, like jumping from one thing to the next, to the next, to the next, and having these ruminations as well that go round and round and round in your head, and just worrying about the gadolinium, feeling guilty about having had it. So it sort of goes beyond as a natural process of grieving, which you'd expect somebody to have. It's kind of like this strange pathological ruminations that just turn over and over and over. The joint problems as well are kind of quite similar. There's maybe other type of joint problems. We have more poppy, clicky joints as well, where joints maybe become a little bit less stable. Skin hardening, tightening, shiny skin, painful skin. Some people also, instead of the hardening of their skin, they actually get this lax skin. So it's like you've kind of aged overnight,
Wow.
and your skin just starts kind of like hanging and doesn't, if you stretch it, it just sort of stays there.
Oh my goodness.
Yeah, and sort of very, very aged. So people often say, "Oh, it looks like my skin is really aged," and just gets so wrinkly and just completely loses any kind of elasticity. What else do we get? Oh, twitching. So muscular problems, muscular weakness and fatigue as well, but also this kind of twitching that goes on. It's sort of called fasciculations, but it's kind of an annoying little jumpy feeling underneath your skin and your muscles, and you can even see your muscles jumping about.
Ugh.
Yeah, it's not much fun. Palpitations in your heart, so skip beats, but also racing heartbeats, and also kind of faintness and dizziness, particularly when you stand up, I guess. Tinnitus is a really common symptom as well, so that buzzing in your ears or ringing in your ears, or even the high, shrill kind of buzzing in the ears. Also kind of a whooshing tinnitus that goes in time with your heart rate. It's sort of a pulsatile tinnitus type of thing. Visual problems as well, so dry, sore eyes, red eyes, very bloodshot, and sort of even seeing these kind of plaques in the whites of your eyes or whatever, and changes in your visual acuity, so you can't see as clearly. Gut symptoms are hugely prevalent, and food intolerances really come in a lot, particularly things like gluten intolerances. You can have new gluten intolerances as well, or flare-ups of old food intolerances. But certainly, a lot of people may or may not realize that they've got new food intolerances, and that the food intolerances are actually making the symptoms of the gadolinium are much worse, or are mimicking them. Or one of the ways that the gadolinium causes problems is to cause food intolerances that, you should be addressing. Also things like obviously constipation, reflux, bloating, even your gut can kind of become looser because of the connective tissue in there, or tighter, and it can kind of fall down, and you can get into problems with all sorts of strange gut symptoms. Menstrual disorders. So quite, some women notice that their periods just stop, and they become infertile shortly afterwards, or you can have just a really huge changes in your menstrual cycle. That was more what happened to me. Was my periods just went completely haywire and lasted really, about 3 times as long as they should have done after my first MRI.
Can you tell us about your experience and what you went through? Because you mentioned you had this, so.
Yeah, so I had it as a screening thing after I was diagnosed with the hypermobility, the Ehlers Danlos Syndrome, because they wanted to look at my aorta. So I had an angiogram, and it was completely normal, as it probably would have been. And I felt okay in the scanner. And then a few hours later, I started getting like a horrible headache. And then that evening, I had just horrific insomnia. So that's another very common one is sleep issues. But I sort of felt like I was switched on and I couldn't switch off. So everything in my body just felt electrified and just very much sort of dialed up. And then over the next few days and weeks, I started to develop this kind of burning pain in muscle and skin, particularly muscle. And it's like that lactic acid burn that you get when you do sprints or, some very intense exercise whenever you kind of reach your limit and you have to stop. Except I was getting this when I was washing my hair or peeling potatoes or, walking up my stairs and stuff. So, it's like just a total metabolic sort of failure type of thing. And then muscle weakness and a bit of shortness of breath and stuff. My blood pressure went up, and I tended to have kind of low blood pressure, and then it sort of shot up into the high blood pressure range of things. My weight started going up. I started putting on about a pound of weight a week. A lot of people actually lose weight. So a lot of people just become quite cachectic, and that's, with cancer patients where they have this.
Yeah, they waste away.
Yeah, just complete wasting. A lot of people get that. I didn't get that. I kind of went the opposite way. I started to just pile on the pounds and put on about 11 kilograms. So that's 20 something pounds in about 6 months. And my weight had been, stable for the previous 10 years. So that was quite interesting. I started, my legs swelled up. So I had this, real pitting edema right from, my feet right up into my thighs. I sort of felt like I was developing diabetes. I was having to run to the loo a lot after eating. But my blood sugars, well, I didn't have a postprandial blood sugar check, but my blood sugars and my HbA1c were okay. My liver function tests became a bit abnormal for a while. What else did I have? I had the brain fog, and I had the low mood, and I had the anxiety. I had the muscle twitching, the palpitations. Despite my blood pressure being very high, I started feeling very faint again whenever I stood up, and especially getting up out of hot baths and stuff. In fact, I thought I was going, oh my goodness, I'm going to faint in the bath and drown.
Wow, this is so awful.
Yeah, it was not fun. It wasn't fun at all. And there was nothing in the conventional medical system that would either, that they could, they couldn't test me for anything. They couldn't do my blood or my urine samples. Not that blood samples are actually useful. And I don't know how really useful urine samples are, given that everybody who's injected with gadolinium retains some of it. So, I don't know how useful it really is. But apart from things like, oh, look, your liver function tests are abnormal, and oh, look, your cholesterol has gone through the roof. Make sure you don't gain too much weight. And, there wasn't an awful lot that was helpful. I did get some physiotherapy that kind of did help, but I think probably by that stage I'd managed to cut out a lot of the foods and start onto a lot of supplements and stuff that helped me to actually tolerate the physio. Oh yes, I had to learn how to tape my joints together as well with kinesio tape, because my knees were popping out so much. Just anything to hold myself together.
Wow. You mentioned earlier women's issues. Is there any indication that it might affect women more than men, or vice versa?
I have a mixture of male and female clients. I would say that the thing that I've noticed as common denominators are people who have issues with their very first contrast. Nearly all of the people I'm seeing are also hypermobile. They may not realize that they're hypermobile, and that their fingers are more bendy than other people's, or that their thumbs are more bendy, until I kind of look at them and go, oh, you're hypermobile.
Interesting.
People who've had Ciproxin or Levaquin or another of the fluoroquinolone antibiotics.
Okay.
Whether or not they're hypermobile, if they've had that seems to be, I've definitely noticed that. I suspect people who've had Lyme disease, probably. I haven't seen as much of that. Okay. And I suspect people who have an underlying autoimmune condition, so something like autoimmune thyroid disease, or autoimmune arthritis, or something like systemic lupus erythematosus, or something like that. Okay. I suspect that those, all of those sorts of things, are Crohn's disease. Yeah, I suspect that those sorts of things are bigger risk factors.
So it sounds like if you're chronically sick, that those are the people who should really be careful about this.
Yeah, and those are the people who are probably getting the most
MRIs. Yeah, that is kind of an interesting factor there, whether it's an association or a causation.
Yeah, and I would expect people with MS probably would have.
So Mollie, I'm wondering if you can share your story now about your MRI and what happened to you afterwards.
It's very similar to Catriona's. I received a macrocyclic. I think she received a linear. So I received a macrocyclic, 4 of them actually. I had a brain tumor. So within 8 days of discovering the brain tumor, and then I was rushed into surgery. So I had the discovery pre-op and post-op scans. And in hindsight, I had reactions, like Catriona said, from probably the first one, but just coming out of a craniotomy, it's hard to tell, Yeah. And so, in that time frame afterwards, I never quite felt right. My eyes hurt. They were blurry. I think that was the first symptom. And even the physical therapist in the hospital had recommended that I see a low vision specialist. So they caught something right off the bat that I had not had previously. So yeah, I just never felt right after that. And I thought it was because I was detoxing all the anesthesia, steroids, pain medications, things I had never had before. So that's what I chalked it up to, is just in the blood trauma of having the skull opened up. It just, I don't know. And I imagine there's probably so many people out there that didn't have a obvious reaction that might just not feel good and not know why, like I did, until I had the fourth scan, where within an hour I was outside gardening, and all of a sudden I couldn't lift the shovel that I was using to dig up weeds. It was like the life force had been drained out of me at once. Like my body was lead. Like I couldn't lift my arms. I couldn't hardly stand. And from there, it was heart arrhythmias, weakness, and all the symptoms Catriona mentioned. But they happen in unison or in different combinations. So it's not just one symptom at one time. It's a multitude of symptoms going on. And for me, it eventually became symptoms going on 24 hours a day, to where you have insomnia, but then you have these symptoms at the same time. So you don't ever get a break. And it's quite defeating.
Wow, I'm so sorry that happened to you. Were you bedbound?
Yes, I was bedbound. In the beginning, I was not, but eventually I couldn't drive. I couldn't do anything. I couldn't take care of myself pretty much. You know, this is all new to me. That's why I made the website, because when I first started, there was a lot of good information. It was just scattered, and it was technical, and I didn't know any of these words or had heard of gadolinium. It made it really hard to navigate for me. And when you're sick too, you know, it adds a layer of difficulty of trying to figure this out when your doctor hasn't figured it out, but you know something's wrong. I think that's where the nightmare of this begins, because you know something's wrong, but all your tests are coming back normal in the beginning.
Yeah, so her website, for anyone who's wondering, is MRI die, that's DYE, and buy, like BYE.com. And so...
No buy.
No buy?
No, it's just MRI.com.
Oh, I thought you said buy. I announced it as buy.
No, I spelled out die just in case people were confused.
I literally thought you said MRI die, BYE.com. I'm like, oh, MRI die, buy. Like, buy MRI die. Okay.
I wish.
So just MRIdie.com. And it does have a lot of different resources. You know, when I was putting this show together, it was my main place that I went to learn and watch videos about it. So it's a great website. But anyway, sorry to interrupt you. Go on.
I know from there, I landed on a supposed expert in chelation and gadolinium. I employed him to guide a local doctor in his protocol for chelation, which turned out to be a disaster for me, using zinc DDPA.
Okay. That's an intravenous one, correct?
Correct. And supposedly people with macrocyclics have a harder time with chelation, and that's why they use zinc. There's also calcium DDPA, which is stronger. And in my case, it was just a really bad idea, and I didn't think I could get any worse than I already was, and the 4 rounds of IV chelation made it much, much worse.
Yeah, because that liberates all the gadolinium, right? It brings it out of the tissues.
I don't know what it does, but my body did not like it at all. I think it is... It's a juggling act of wanting to get this stuff out, but it's also like you're dealing with an atomic bomb. It almost feels like you want it out, but it also feels very, very dangerous to handle. So after that, I was just like, I don't know what to do. I don't know if I can handle this. Isn't living. I don't want to drug myself into a stupor to be able to, maybe get a break from this pain, because that's not living. But living in 24 hours of pain is quite difficult, and it's really hard when you want to take care of yourself. You have things you want to do, and you're dependent on other people, which, you never know if that's going to continue, if you're going to have support. Yeah, it was just really difficult, and I ended up finding a chelator that did work for me, and thank goodness. But, I think I listened to one of your earlier podcasts, and you're not a fan, and I'm not either, but when you're losing the ability to walk, or
totally,
you're having these intense symptoms like your heart or your lungs, it's difficult to breathe, you would like to increase your metabolism and support your body, but at the same time, I was just like, it feels like I'm dying and I want this to stop as soon as possible. And I don't know how long it will take with other interventions. But yeah, I ended up finding a chelator that's not necessarily on the market that I experimented with that worked for me.
What is that one called?
The chemical abbreviation is NBMI. The drug name that it will eventually hopefully be sold under is Erminex. But it was available as a supplement, and because it's one compound from cinnamon and another compound found in blueberries. So
interesting.
Under definition, it should fall as a supplement, but there's some controversy which made it have to go through the process of being approved as a drug.
Yeah, I did say, I think in a previous podcast, that I wasn't a huge fan of chelators, but if you are like poisoned with a heavy metal, like you have lead poisoning or you have mercury poisoning or something like this, then you need that, you know? I mean, you need to get those metals out. But I think a lot of people kind of abuse chelators, like EDTA, you know, they'll use it for brain health and stuff like that. And I think that can mess up your mineral balance.
100%. If you're healthy or you just have mild symptoms, I would say go as gentle as you can and holistically as you can. But for the people that are wheelchair bound or have lost the ability to walk, there are not a lot of options.
Okay. So Catriona, I watched a video that showed people trying infrared saunas and stem cell therapy. Are there any treatments out there that you have found that work?
It's a great question, Lucas. I actually have found that for me, and actually probably for a few other people as well, really getting back to basics with the diet and also doing a lot of lifestyle things is really helpful. So what I found, I'm now on a practically autoimmune protocol diet. I have left dairy in, but everything else that's not allowed in the autoimmune protocol I've cut out. But I've basically cut out all the grains, all the pulses and legumes, all nuts and seeds, all eggs, all seed spices, caffeine and chocolate and stuff like that, and the nightshade vegetables. So that's things like tomatoes and potatoes and bell peppers and, chilies and stuff like that. And it turns out that I was actually having reactions to all of those after the gadolinium, and taking all of those out seems to have helped a lot, even with things like the leg swelling and sleep and everything. I brought in quite a few medicinal foods, like a range of medicinal mushrooms and some medicinal herbs or vegetables that have kind of quite medicinal properties, like gotu kola. And I use a range of supplements, so things like D-ribose and PQQ and zinc and magnesium and, a good B vitamin, vitamin D3 and vitamin K2. So quite a lot of supplements in there and quite a lot of medicinal foods.
Did you ever do chelation like Mollie?
Not actually an option for me where I live. So, so I'm in Belfast in Northern Ireland in the UK, and we don't have a toxicology service here. There is one there's a couple of places in England that have a toxicology service. So, yeah.
So I saw Chuck Norris's wife, I think, had this too, and she was doing all kinds of crazy things. I mean, she was doing like acupuncture and infrared saunas and stem cells. Mm-hmm. I mean, obviously that's out of the budget for most people, but either one of you guys can answer this. Are there any treatments like that work? So, I mean,
we do know that sweating actually does eliminate quite a lot of toxins, not just gadolinium, but a lot of the other, other heavy metals, but also some of these things like phthalates and plasticizers and a lot of the other things that we're exposed to, pesticides and all sorts. So I think definitely reducing your toxic load probably is quite important. I see that there are quite a lot of people doing niacin saunas where they would take the flush niacin.
The Scientology approach.
Well, I think there probably is something to it.
Yeah, I've done it.
There's... Yeah, have you? Yeah. How did you find it?
They're nice. They make you feel really good. Yeah. I mean, just a niacin flush on its own makes most people feel pretty good after they get over the discomfort.
Yeah, the prickling.
Yeah.
Yeah. So quite a lot of people, and a lot of people do seem to be getting some at least short-term symptomatic relief from that. Hyperbaric oxygen therapy, that's something that some people are trying, and again, some of the results are really good. I don't think there seems to be anything that is that works for absolutely everyone. So some people do get some side effects from all of these things. So which makes it hard, because when you're already feeling about as low as you want to go, you don't really want to dip any lower, do you, Molly?
No.
Yeah.
Okay. So Molly, other than that one chelator that you used, Molly, is there any other treatments that you found have potential?
I'm using a lot of other things as well, and trying to just correct nutritional deficiencies. In the process of using that chelator, I knew my molybdenum had been low, and this chelator is sulfur-based, and molybdenum's crucial for sulfur. So for the last month or two, I started feeling really bad again, and then pieced it together. So correcting any kind of deficiency, vitamin D, magnesium, those are two that I'm typically low on. So I take all the fat solubles.
Yeah, I imagine if you were low in molybdenum, I know that's kind of crucial to your aldehyde hydrogenase system. So alcohol was probably out of the picture for both of you guys, I'm guessing.
Oh yeah, I would have trouble with alcohol beforehand, and sulfa drugs, so I just didn't take the molybdenum as seriously. Now I know how critical it is. If you have any of those type of symptoms during or pre, and it supposedly helps with the glutathione levels, which is important for detoxing as well.
So if you have one of these MRIs, with these agents, and you suspect you might be harmed, either one of you, what are your first steps that you should do?
I would say find out what you were given, then in the U.S., contact the FDA, report it to the fairs. I believe the MedWatch. Report your reaction to the FDA. I would say find out what you got and report your reaction to the FDA. Those would be the first two steps. But in the U.S., it's not. They don't have to record the dose or the brand that you were given by law. Like I said, I think most places do record that information, but if you have trouble finding out, that's probably why.
Catriona, what do you think first steps should be?
Yeah, I think those are great. I think a lot of people probably want to feel better, so things that you can do to feel better. So I would probably get my doctor to run a celiac screen and some autoimmune blood work. But if your celiac screen comes back negative, I would still actually do some dietary eliminations. So I know that a lot of people struggle with doing an autoimmune protocol, but that's actually, I think it's really worth trying to do that diet. So where you eliminate a lot of things and also focus a lot on the most nutrient dense foods, particularly things like the liver and the organ meats and the bone broths and heart and stuff like that. And yes, supplements that I find helpful, probably things like alpha lipoic acid and N-acetylcysteine, but you should probably work with a practitioner on all of these sorts of things. With the anxiety being so horrible, I really do think that things like mindfulness, meditation, and gratitude, and trying to reduce your stress are really important. And getting help, asking people for help, and helping you to just do normal things, and not feeling bad about asking people for help either. I think it's really important that you sort of maintain your contact with other people, because a lot of something that a lot of people do as well is kind of isolate themselves when they feel sick. It's a very normal response. And it's probably a kind of
definitely
a survival tactic to lurk in the back of your cave and not come out. Having conversations about it can be very difficult. So if you're finding that the people that care about you and that you care about don't really understand the whole gadolinium thing, and you're starting to feel a bit gaslighted, which happens to a lot of people, I wouldn't try those sorts of topics. That can be very difficult. Or I'd get them to read up on it, and certainly they can read my book, and hopefully that would make them a lot more clear. Or read Mollie's website, or my website, or the gadoliniumtoxicity.com website, just to try and find out more about it, because it's very difficult if the people that should be supporting you don't believe that what you're going through, and that happens a distressing amount of the time.
Okay.
Yeah, and just trying to do things like the Epsom salts baths or saunas or whatever that they can, and staying hydrated and adding lots of salt, and all that sort of thing.
So before we wrap up, I mean, is there anything that we didn't cover on gadolinium that we should kind of go back and go over?
We did cover a lot, haven't we?
Yeah, we did.
It's nothing that's really, nothing that's jumping to,
Everything but conflicts of interest, which I think that would take a whole show.
Oh, we did not talk about conflicts of interest. I actually have that question written down and I skipped over it. Okay, real quick, in a couple minutes, what is the conflict of interest going on right now? Because there is a supposed conflict of interest kind of downplaying the risk with these contrast agents.
Oh, that's a good question. So I suppose almost all of the research on these contrast agents is produced by the companies that manufacture and sell, make a profit from them. So that's, companies like Bayer and Bracco and Gerbe and various other ones. When you look at these published research papers, it's probably best to look at these more as paid advertising, because the companies, they'll sort of design trials in such a way that they minimize the likelihood of actually identifying side effects. So, for example, a lot of the trials, looking at side effects, a lot of the trials only follow people up for about 25 minutes to 48 hours to look at side effects.
Oh, that's nice.
Yeah, there isn't really research looking at people for more than about 48 hours. And there's even things like, whenever I was looking up some of the original research, looking at brain toxicity, the group of patients that they would have used would have been patients, probably a bit like Mollie, patients with brain tumors. And they selected like a smallish sized group of people. But whenever they were following them up, they're much worsened symptoms. They couldn't tell if that was because they had brain tumors and their symptoms were progressing, or because they had surgery and that was making their symptoms worse, or because they were getting radiotherapy and that was making their symptoms worse, or because they were getting chemotherapy or other drugs or anesthetics.
Yeah, so many different factors.
But and they highlighted all of these things, but their conclusions were, we find that it's safe, when the conclusion should have been, in retrospect, this wasn't the right study design to address this problem. You would need to do this. So there are all sorts of these things. And then when you look at regulating agencies like the FDA, there are, some people working with the FDA go on then to work for
the companies,
or to become CEOs, of the pharmaceutical companies. So is
there any independent research going on right now?
There may be bits and pieces, but again, Dr. Brent Wagner is doing quite a bit of independent research in his university. So probably some of the independent research is from universities. But what you also find is that sometimes when people have wanted to do research on things like IV chelation, their funding has been pulled, and that's happened once or twice as well. So again, I think that comes under conflict of interest type things, because a lot of these big pharmaceutical companies and big food actually provide a lot of funding for universities. So even though you'd think that universities and even government agencies would be very independent, it's, you can't really bite the hand that feeds you.
Yeah.
And these corporations have so much, if they're paying millions out, it's very, very difficult to sort of go, oh, we're going to criticize, going to take something that is going to, affect your bottom line. So, and then as well, when it comes to publishing studies in peer-reviewed journals, your peers are probably going to be the people who are making money from the contrast agents. So that can certainly colour whether your study is published in one of these big journals at all. Yeah.
Okay. Mollie, do you want to add anything to that?
Yeah, well, one of the most striking things I've seen recently is there was a study out of University of Boston, and they had looked at brains from their CTE registry and found gadolinium in the frontal cortex. And on the radiology journal's website, at the beginning of that paper, they had in red letters, "See this editorial by so-and-so, who's paid by all four contrast makers," at the very beginning of that paper, before you ever got to the meat of the Boston University paper. So the journal is, obviously doing the bidding for somebody there. It was very interesting to see that.
Wow. So yeah, let's wrap this up. Mollie, why don't you tell us about kind of what you do, how people can reach you if they have any questions, and what kind of things you're working on now?
I just squawk about gadolinium. I'm not an expert. I'm just a patient. So my website's there to help people get started, whether if they're a patient or they're trying to help their friends or family members understand what they're going through. And right now I'm just at the beginning stages of starting my life over. So they can contact me through the website, but again, I'm not an expert. I'm just a patient. So it's probably best to contact somebody like Catriona if they have more questions.
Okay. Catriona, same to you. What are you working on, and what do you do, and how can people contact you?
Sure. So I am now a nutrition and lifestyle coach, and having done a pivot from being a consultant pediatrician working in the National Health Service in the UK for about a decade and a half. So now I help people to optimize their health using diet and supplements and lifestyle, with a particular focus on people with gadolinium toxicity from MRI contrasts. But also, I'm also kind of helping to support people with burnout, because that was really what caused the whole thing. And my whole decompensation, I completely burned out. So I've written a book called Contrast, More Than Meets the Eye, demystifying the devastating damage due to gadolinium contrast and some natural steps you can take to reverse those dreadful effects using diet and lifestyle. So that's available as an ebook now, and you can get it from all the big ebook stores. And I'm working on a paperback edition to come out in the summer after. At the moment, I'm actually working on creating a kind of a mastermind, a group coaching course for people with burnout, professionals who are suffering from exhaustion and burnout, called Burnout Antidote. So after I've got that done, then I'll get back to creating the Contrast More Than Meets the Eye on paperback and releasing that. So yeah, if people do want to, if they are confused or they'd like some help or support making dietary and lifestyle changes that will help them with their gadolinium symptoms, yeah, give me a shout. I'm at thefoodphoenix.co.uk.
Okay, so thank you so much for both of you guys coming on. I really appreciate it. This is such a crazy subject, that this is going on out there. So, but it sounds like it's a par for the course for a lot of things in the pharma world.
Thank you.
Okay. Thank you, Lucas. Been lovely chatting to you.
It's good to meet you.
Lovely. Yeah, it's lovely to see you too, Mollie. Nice to put a face to the name.
All right. Yeah. Bye-bye.
Bye.
Okay. Bye-bye. Bye.
I hope you liked the interview with these two wonderful ladies. One quick correction, Mollie wrote to tell me that the paper she mentioned was actually about the cerebral cortex and not the frontal cortex. What really got me in this interview was actually Mollie's story. I have so much compassion for what she went through and just the absolute debilitation she experienced after multiple MRIs with this gadolinium stuff. That kind of experience can either break you or make you stronger, and it sounds like Mollie is one tough cookie. Dr. Catriona's information was really great as well. I will have all her links as well as Mollie's website in the show notes. Thanks for listening, everyone. The website is quackspodcast.com. If you feel like helping us out, you can use our Amazon banner on the front page to shop on Amazon. You can also send us an email at quackspodcast@gmail.com with any questions. See you next week. Be well.